repeat my message from last night. City government and all of our partners are working around the clock to prepare our city to support our vulnerable populations here in Boston, to provide accurate, up-to-date information to all our residents. And every single person has a role to play. We're asking people to stay home if possible, practice social distancing at least 6 feet apart, wash your hands with soap and warm to hot water, as well as hand sanitizer throughout the day if you can do that. We want you to cover your mouth when you cough or you sneeze. We want people, if you're feeling sick, please isolate yourself. Staying home, call your healthcare provider, or if you can't get through or you don't have one, you can call 311, and we will have the mayor's helpline to kind of give you a briefing on the steps you take. We're asking people not to go directly to the emergency room or doctor's offices. You should call before you go, just so they can assess you over the phone as we move forward. We're asking people to take extreme precautions, particularly around seniors or medically vulnerable people, because they are vulnerable, and we want to make sure that we keep them safe. So if you have a parent or an elder or a neighbor that you want to help, and they need something at the store, you can pick it up, drop it at the door for them, and let them know that it's there for them. For those people feeling stressed, I encourage you to focus on the contributions that you can make, including social distancing. Also, one thing that was told to me yesterday, I was asked, am I eating? Which I hadn't done, and was I drinking water? So it's suggesting to people, drink water. Make sure you drink water, stay hydrated. Those are things I haven't heard yet, but when I did it, you feel better about it. So those are little things that people can do. I encourage you to share messages of comfort and support to each other. Touch base by a phone call, a text to somebody, something that's really important that we can do. Everyone definitely has a clear purpose in the effort that we're going through. To update you today, and these are numbers as of yesterday, we have 45 cases, positive cases of coronavirus in Boston. We expect more state updating numbers later today as the day goes on. And in the state, it was 218 people. We're in constant communication with hospitals, and we're working with state and federal governments and advocates for supplies and services people need. So I've been on the phone today with several of our hospitals in the city just to kind of get an update on where they are, and they're working on some briefing us on where they stand. It's important to remember a key goal is to protect the capacity of our hospitals so we can handle the peak in a crisis, something that we're looking at. I think that right now is still not a peak, and we want to make sure that the beds are available, and we're going to work with our hospitals as we move forward here the best we can. Social distancing is a must. And as we've seen businesses shut down and working from home, the more we can do that, the more we can potentially prevent the widespread of the virus, and something that I wanted to continue to say. Some updates on our work here at City Hall. As you all know, but just to reiterate, schools, libraries, pools, gyms, community centers, all programming remains closed. If you want up-to-date information, you can go to the cityofboston.gov website for any information you want. I mentioned last night that there's Chromebooks and movies and things available at the Boston Public Library. You can go to bpl.org to find online resources that we have. City Hall services. The city has 18,000 employees that provide critical service to the people of Boston. Some of those services include regulated services necessary for residents to stay safe and healthy, and city functioning at a basic level, like public safety and trash pickup. So we're going to keep the city moving in as much as we possibly can to make sure we continue to do the basic, crucial city services that are available. Emergency services people need right now in crisis, like food access and senior outreach. Our HR Commission continues to do that. Employees this week, we've begun informing departments about who should be working from home, and many are doing so now. And by the end of today or tomorrow, everyone will know who can be working from home. Some of those folks that are working from home, we might need to deploy them out into the city to do something, but we're working through this as we speak right now. We've put plans in place for staggered hours for some who must maintain critical operations. I was walking around the building today, some of those windows that we have downstairs that do birth certificates and tax collections, things like that, and I thank the folks that are working there. I'm asking people to be patient with them. As much online you can do as possible. If you have any questions, you can call 311. We can let you know what services are available online. So as much as possible, we will do as online service here in the city of Boston. Our goals is to practice social distancing. We have extra cleaning going on at City Hall in all of our buildings throughout the city, in all of our city operations. Maintenance is a critical operation, and maintaining operations is critical. Public health and public safety, trash and recycling. As I mentioned last night, and I think I might have made a little bit of a mistake, but I'm going to clarify it right now. Street cleaning, we will not be ticketing or towing for street cleaning purposes. So as we go around, and that was a question that was going to be asked, I could tell already. As we go around the city, street cleaning starts, I believe, next week. So you're going to see street cleaners out there. Obviously, they're not going to get to the curb because a lot of cars are home, but we're going to do our best to keep the street clean. Parking, we're going to continue to clean parks. And we're going to continue to service our food access and our children, for our children and families. Our election department remains open. It's a function that's important for us to move forward. Our procurement department remains open. We have essential and emergency supports for our seniors, for our veterans, for our immigrant communities, for our homeless community, and for our children. City Hall remains open, but we discourage anyone from coming in unless they have urgent need for services that cannot be done online. So we're asking people if you potentially could do that. I would truly appreciate that. For families and children, and we started yesterday, free meals are available for families every weekday morning from 8:30 to 11:30 at sites across the city. Those BPS students that were sent home have the information, but any family members looking for information, you can go to the website at boston.gov to see where the maps were. Yesterday, we served 1,360 meals. We have 53,000 kids in our district, so we're expecting those meals to increase as we get through this week and into next week. BPS received 20,000 Chromebooks yesterday and has launched a plan to get them out to our students who need them for learning at home. And we're going to continue to provide updates to our family via text, calls, emails, and our website. Any questions you have on Boston Public Schools, the bostonpublicschool.org/coronavirus. And I want to thank the press again because you're putting this information up on the newscast for families, so thank you for doing that and in the papers. For seniors, our Age Strong Commission is reaching out through every available channel, through our buildings, service providers, phone calls in multiple languages. We're working to continue in-home service that many seniors rely on, including groceries and Meals on Wheels. Nursing homes and assisted living facilities are not allowing visitors. It's important that we adhere to that. Some people I know I'm hearing that are concerned they can't go in to see their parent or their loved one, but really it's for the safety of their parent or loved one that these rules were put in place. And it's important that everyone who is interacting with a senior or somebody that's sick take precautions. We can't stress enough washing with soap and warm water, sanitizing, disinfecting not just work areas but doorknobs and areas that the public touches, and keeping a distance is really important. We're also hearing concerns about food access. Most of the food pantry sites seniors use are still up and running, using a grab-and-go package with the special precautions around social distancing and cleaning. So as our food pantries are seeing an increase in people using them, they're going to be putting in different types of rules so that we don't have too many people in a certain space. And again, that's another, I'm asking people again to be patient as we're seeing our world literally change in front of us. If seniors have an issue with food access, we want you to please reach out to 311. Many seniors have the contact directly for our Age Strong Commission, or reach out directly to Age Strong Commission. Those of you that might be listening and not sure what Age Strong Commission is, our Age Strong Commission is our office for older Bostonians. So if you have not been connected there and you call, that office is specifically there for you, so we want you to access that office and use that office. If you have any questions or concerns, as I said, the best number, if you're looking for a question or a concern, 311. We've put on extra call takers, so we're going to be able to handle the volume. There was yesterday a dip in service in the morning to early afternoon because of the volume of calls around construction. And since that time, we've gotten the clear guidelines around construction out, so people understand it today. When we announced it the day before, I don't think we got the information out quick enough in a very clear manner, so we took care of that yesterday, so we're seeing calls go down. I'm also joined by several city councilors that are here. For the public, a lot of you have relationships with your city councilor and your state representatives. Please feel free to contact them as well, because we're in this together and we're working together, and it's all the same information that we're going to get to you. So do not hesitate in that particular case. For people experiencing homelessness, city agencies, the Boston Public Health Commission and the Department of Neighborhood Development are working with our partners Our partners at Boston's Healthcare for the Homeless, Pine Street Inn, Boston Medical Center, St. Francis House, and many other homeless organizations in our city. We are working to make sure that people experiencing homelessness are supported and that they're kept safe. There are no plans to close our shelters, but we are putting in place special measures to prevent the virus from spreading. We're going to continue to operate our emergency shelter system safely and care for those needing observation, quarantine, or more serious levels of care, and additional supports that are needed if needed. The city is finalizing a comprehensive plan for people experiencing homelessness, so we want to make sure that if we have a situation where we have somebody in our facility that has coronavirus, we want to be able to isolate not just that person, but isolate an entire groups of people so that we don't see the spread of the virus go through our whole population. We are acting now on certain parts of the plan, which includes screening and testing and isolation facilities located behind the Boston Healthcare for the Homeless and next to our 112 Southampton Street shelter in Pine Street. So you're going to see tents that are going up. And we're working on making sure that we're taking care of our homeless population. And we're also working with other opportunities to have more places for our homeless folks to go if in the event that we have to separate our homeless population in the city. We're in constant connection with other shelters in the city and other street outreach staff, ensuring everyone has the latest development and the guidance on the COVID-19. So we're going to work with other people's staff as well to make sure they have the most up-to-date information. As I mentioned the other day, a few days before this coronavirus came to Boston, we might have been acting as separate entities, and today we're all one. So there's no lines. We're working together as one cohesive group to make sure that the people of Boston, whoever they are, wherever their concerns are, we're working together. I also want to add, over the last 5 years, we've transformed the Boston system for serving and housing homelessness. We've housed over 2,200 chronically homeless people. That work and those relationships are paying off now for our ability to respond to this crisis. If we didn't have a system in place that we put in 5 years ago, we would have thousands of more people on the streets of Boston. And because of that, we were able to mitigate a little bit some of the potential concern. Public transit. We are discouraging public transit for social distancing reasons, but we understand that some people rely on it. The city is in regular communication with the MBTA and their latest update. Most of the systems are operating on a Saturday service level. The MBTA did add back additional capacity today, including E-Line and Blue Line and higher frequency bus routes. So they experienced yesterday when they went to the Saturday schedule, they saw a lot of people taking the buses and trains. So what they're able to do is add additional capacity today to alleviate some of those concerns. They've increased their cleaning schedule, and for full details on the MBTA, you can go to www.mbta.com/COVID-19. That's www.mbta.com/COVID-19. Just to quickly run through the updates, and again, this is more. We will provide this to the press so you can put on your screens. For Boston, for the most up-to-date and accurate information, we're asking you to go to boston.gov/coronavirus. Anyone in the city can call 311 and get a live person on a phone. And the phone lines are up and running, and it's 24 hours a day. We're asking people, if you'd like to get notified by text, you can text BOSS COVID to 99411. That's 99411, and text the word BOSS COVID. To follow me on Twitter, or the city on Twitter, this is the city Twitter page. It's @Marty_Walsh, @Marty_Walsh. On Instagram, it's @Boston_Mayor. Please make sure, do not trust rumors. The information that the press is the most accurate information, or information that myself or other elected officials and the governor that are giving is the most up-to-date, accurate information that we have at that particular moment. So make sure that there's been a lot of rumors about sheltering in place and all the different things. There is no shelter-in-place order. There's no current plan to issue such an order on any particular date. As I said, I remain in constant contact with the governor and state officials and other mayors. I was on 2 phone calls today with mayors from across Massachusetts that were talking about situations and how we move forward. So obviously, if situations change, We will update the public and let everyone know, but it's really important that's kind of gone rumored a few times a day, and that's as of right now, that is not a situation that I think we can talk about.